Mundo, hello world, hola mundo, hello monde. We are here today taking a cappuccino in Toronto at the Canadian Critical Care Forum and discussing with Sean Bagshaw from University of Alberta in Edmonton about critically ill patients. So Sean, the debate is how early should we treat patients with AKI with renal replacement therapy?
It's a great question, Claudio. It's one that there's not a lot of broad consensus on, that we've seen there's a lot of variation in practice, and really it's a question that requires high-quality clinical evidence. So we've just finished a pilot randomized trial that's looking at this very issue. We're hoping to be able to start a larger 3,000 patient trial in the next few months that's going to give us more definitive data on this very question on when to optimally start renal replacement therapy in critically ill patients. There certainly are some advantages to starting early. You get, azotemic, electrolyte, acid base, fluid balance, homeostasis, more well established, but there's some risks as well. You're exposing patients sooner to dialysis when they may not have needed it. They may have recovered otherwise. You're also exposing them to an extracorporeal circuit. So there really is a balance between, benefit and risk, and we're not totally clear from the evidence when the optimal time is yet.
What do you think is the role of biomarkers in this? Can they give us a number when to start?
That's a great question as well, and certainly in our trial we looked at whole blood NGAL to help us decide about when we could initiate renal replacement therapy, and it didn't seem to be that useful in this context. I don't think there's any other commercially available biomarkers out there right now that can really be used for clinical decision support on when we should select a patient for dialysis therapy in the ICU. I'm hopeful that in the next few months to a couple of years we're going to see new data on new biomarkers that specifically answer that question. When should we decide to start renal replacement therapy? But right now, I don't think there are any.
And also we should think that there will be probably no magic number. The physician evaluation will be always the key for personalizing the therapy in spite of the recommendation given by a randomized controlled trial. With this, I thank you very much for joining today, Cappuccino, and I wish you a very pleasant day. Excellent.